For the last few weeks, we've been working closely with the DOC officials.
And today at the Department of Corrections, the Department of Public Health conducted the first wave of TB testing of all pretrial detainees and contempt of court clients housed in their dome facilities, the location of where a detainee tested positive for active TB.
We're concentrating on the dome post where the original host came from, and that was post 25, domes 25, 25 alpha, and 29, and that consists of 117 people.
From the domes, DOC is fanning out to every single housing unit.
We're going to test the whole Manila compound, and we're looking at 470 plus inmates. Again, if time permits us to do that today. However, CDC has informed me that they will be scheduling days after today for the reading and another testing date as well.
DOC was initially planning to test close contacts confined in the domes, but ultimately DOC Director Jose San Augustine made the decision to have everyone tested, including staff. Public Health Center for Disease Control Program Manager Cecilia Arciaga.
We have enough supply, and for this screening we did bring a lot, and DOC also procured a lot of supplies to cover the rest of the employees that needed to be tested.
So what happens if someone turns up positive? Limo and Arciaga say plans are already in place to address the potential.
We're going to have rooms available. If in fact they do test positive, they'll be brought to another screening area and be advised by CDC personnel for what we're going to do next.
Just like in any contact investigation, if we find anybody with a positive skin test or what we call a latent TB infection, we would ultimately do a repeat chest x-ray. And the x-ray, of course, will tell us exactly what's the status, whether the germs are just sleeping or they're starting to become active.
According to Limo, out of the 30 to 40 individuals that have been tested so far, 0 have turned up positive.